Um, I now call this meeting to order. The time is 8:31 and the uh, Oregon Board of Physical Therapy is entering into public session. And Michelle, could you please call the roll?
Yes, ma'am. Timothy,
Here.
Mariah, Sandra, I think you may be on. Okay. For the record, Sandra is here.
Here, I got it. I couldn't find my button.
Thank you. Susan,
Here.
Erica,
Here.
Dwight.
Here.
For the record, members Aaron and Hoku are excused. For staff, Michelle present. Sherry,
Here.
Gayla,
Here.
Sarah,
Here.
Jade,
Here.
and Joanna.
Present.
Okay. Let's see. We can't ask Mariah to read that. No voice there. So, Tim, could you please read the statutory purpose?
Yes, I can do this. The Oregon Board of Physical Therapy meeting and its statutory purpose is to protect the public health, safety, and welfare for all Oregonians by maintaining standards for quality of care, professional skill, and competence through effective regulation of the practice of physical therapy.
Thank you.
And Madam Chair, we do have several members of the public present for the meeting.
Okay.
And per prior discussion, we will jump to item D1. And I can turn it over to Holly Gilkinson for her presentation. And Holly, if you just tell me next slide, I will advance the screen.
Okay. Thank you so much, and good morning, members of the board. My name is Holly Gullickson. I am an assistant clinical professor in the DPT program at OSU Cascades, and I really appreciate the opportunity to speak with you. I'm also joined today by 5 OSU Cascades DPT students: Danielle Barton, Hannah Dozier, Isabella Cruz, Peyton Robinson, and Caden Spildy. And today we are addressing an issue in our PT profession. If you can go to the next slide. This is impacting our profession at a national and a statewide level. There's a workforce shortage in Oregon, especially impacting our rural communities. In Oregon, there are nearly 300 open physical therapy positions. This is based on the 2025 Workforce Needs Assessment Report, and every single one of them is rated officially as difficult to fill. And looking ahead, our 10-year demand for PTs is projected to grow by nearly 15%, while general population growth sits at just 8%. This deficit hits rural clinics the hardest. With high Medicare and Medicaid payer mix, these facilities face lower reimbursement rates and tighter margins, making it nearly impossible to offer competitive wages or incentives to recruit new graduates. Next slide. So as a board, you know the vital role that our profession plays in population health, but the financial data really underscores why this shortage becomes a public health concern. When patients receive early access to PT for movement system dysfunctions, the downstream healthcare costs drop dramatically, saving anywhere from $2,000 to over $40,000 per patient. Additionally, we know that non-pharmacologic pain management through PT directly addresses the opioid crisis in these underserved areas. When rural Oregonians lack access to PT, both health outcomes and healthcare costs suffer. So with improved direct access to PT, we can also help reduce visit burden for our rural PCPs for musculoskeletal conditions, which are the second leading cause of primary care visits. Next slide. So where's this disconnect? Let's look at our existing state workforce solutions. In 2017, Oregon established the Healthcare Provider Incentive Loan Repayment Program to ensure equitable provider distribution in rural and underserved areas, offering up to $50,000 a year to repay qualified education loans in exchange for a 3-year service commitment. Eligible providers must provide essential healthcare services to an underserved population as determined by OHA. So professional and technical providers in primary care, oral health, and behavioral health receive essential loan relief, but PTs are left out of this program. The OHA has expanded the eligible provider list in both 2022 and 2024 in response to workforce shortage needs, but PTs still remain excluded from this program. Next slide. So ironically, we do see state support for PT as an essential part of the rural healthcare team through the AHEC Scholars Program. This federally funded, state-operated, 2-year interdisciplinary program prepares health profession students for rural practice through 80 hours per year of dedicated didactic and experiential learning focused on treating the needs of the rural healthcare population. PT students actively participate in the AHEC Scholars Program, earning their certificate alongside med, dent, nursing, and pharmacy students. In fact, we have 2 AHEC Scholars from OSU Cascades with us here today. However, when they graduate, they cannot access the key incentive tied to this amazing program, which is the state loan repayment funds. So we're successfully training them for rural practice and supporting this, but then failing to provide the policy mechanisms that make staying there financially viable. Next slide. So this exclusion is critical because the education debt load for new PTs has really reached a breaking point, and I know you're aware of this already. Average DPT tuition ranges between $106,000 to $126,000 or more. When combined with undergraduate loans, our graduates face an average cumulative debt of $150,000. Against average starting salaries of $75,000 to $88,000, this debt to income ratio ranges from 1.2 to 2.0, which is well above the recommended healthy threshold of under 1. Our students at OSU Cascades consistently report to us that this debt delays major financial milestones, such as buying a home, starting a business, or even starting a family, and it heavily dictates where they can afford to practice. With federal loan support in jeopardy as well, state-level programs become even more essential to supporting our healthcare workforce. Next slide. Because this is an issue that directly impacts students, 4 of our DPT students will now be sharing how rural practice and debt support would impact them. Our 5th student, Kaden, isn't presenting but is available for questions along with our other students. So Danielle, I'll pass it off to you.
I think you're on mute, Danielle.
Thank you. Sorry about that. Thanks, Dr. Goldson. My name is Danielle Barton, and I appreciate your time today. As a soon-to-be third-year student, physical therapy student, I'll graduate with roughly $125,000 in student loan debt after 9 years of higher education, a bachelor's degree, plus 2 years of prerequisite schooling and preparation for this 3-year doctoral program. To put that into perspective, there are professions that require less schooling and see comparable or better pay with a fraction of the time and cost invested in education. And these other professions are eligible for loan repayment programs that we are not. That disparity makes it hard to justify choosing a lower paying rural position when I'm already carrying 6 figures of debt for a doctoral level degree. I genuinely want to serve rural communities, but without a loan repayment option, I'm being financially pushed toward higher paying urban settings instead. This is part of why I've stayed engaged in advocacy as the former APTA, Oregon Student Leadership Committee Chief Liaison, where I've helped to get fellow students more involved in APTA-related advocacy efforts. I've seen firsthand how many of us care about these issues, but need a path to act on them. If PTs were included, I believe you'd see more new grads choosing rural practice, and some, like myself, pursuing private practice ownership in those communities, meaning people there would finally have consistent, locally rooted access to musculoskeletal and rehabilitative care that keeps them mobile, independent, and often out of the hospital or off long-term pain medication altogether. Rural areas already face well-documented healthcare workforce shortages, and physical therapy is no exception. When PTs are left out of loan repayment programs that are available to other health professions, it removes strong incentive new grads have to choose rural practice over a higher paying urban job. The result is that rural clinics struggle to recruit and retain physical therapists. Patients face long wait lists or long drives to the nearest provider, and some go without rehab care altogether, which can mean slower recovery from surgery or injury, worse management of chronic conditions, and greater recovery and greater reliance on emergency care or even opioids for pain that physical therapy could otherwise address. Exclusion from these programs doesn't just affect physical therapists' career choices, it influences the ability for rural patients to access care close to home. Long term, I'd like to open my own private practice, ideally in an underserved area, and loan repayment would make that goal far more attainable by freeing up the capital I'd otherwise be putting toward debt. If physical therapists were eligible for programs like the Oregon Healthcare Provider Incentive Program, that debt relief would go a long way toward making rural practice and eventually private practice ownership a realistic choice instead of financial sacrifice. Thank you for considering this call to action and to be included in the Oregon Healthcare Provider Incentive Program. The next slide is introducing Hannah, but it doesn't look like she's here today. So I'm going to pass it on to Isabella.
I am here.
Oh, I'm sorry, Hannah. I couldn't see you on the screen, and my apologies.
No, you're good. We're sharing.
Okay, got it.
All right. So I'm Hannah Dozier. I'm a second year student at OSU Cascades. I am from Prineville, Oregon, so rural community just an hour away from where I'm attending school. And the gift of where my program was is that I got to remain in the community that I grew up in for the entire 4 years of undergrad. And then I've got to stay close to home while I've been in my program. So I still feel really connected to where I grew up. I am currently in $149,000 in debt and counting from exclusively physical therapy school. I had the honor of accepting grants and scholarships for my bachelor's degree that completely covered my cost of attendance, but there have been very few opportunities for this type of financial reimbursement or assistance in graduate school. The average interest rate across my student loans is 8%. My outstanding interest is already $10,662. As someone who always wanted to be a physical therapist, regardless of my projected debt to income ratio, I do accept responsibility for my decision to enter this profession. But what I didn't expect was how difficult it is to hold a job as a graduate student, and that I would need to take out the full loan amounts to pay my expenses. And there are very few resources to help students and graduates of physical therapy programs. Given that we are not eligible for programs that assist with student loan repayment for working in rural communities, I was pushed away from my goal of serving my home community in Central Oregon and instead toward one of my only options that seemed viable for not only my career but for my personal life, which is moving to the Portland metro area and working for the VA as they offer loan payment reimbursement up to $40,000 a year. Given that so many healthcare professionals that physical therapists work with on the interdisciplinary team are eligible to benefit from state programs, it's discouraging as a clinician preparing to enter the workforce to not be eligible, especially as the shift is made toward physical therapists as primary care musculoskeletal providers. I look forward to seeing what the board and APTA Oregon can accomplish regarding further advocacy for our inclusion in this program, as it would be not only a gift to the rural communities that raised many of us, including me, but an opportunity for us to feel empowered to serve rather than forced to financially compromise. Thank you for considering this call to action for inclusion.
Hello, my name is Isabella Cruz. Thank you so much for taking the time to hear from us students. I am a second year DPT student at OSU Cascades. I am passionate about providing care to those in need and reducing healthcare disparities. And I feel really fortunate to be part of a growing profession that provides essential services. It puts me in a really advantageous position to be able to address these issues in healthcare access and equity. I am part of the NAO's Scholars Program, which really helps enhance my learning in by providing supplemental educational resources and opportunities to learn more about providing healthcare in a rural setting. It provides me with resources to manage the challenges that can arise with rural healthcare, and it really enhances my ability to communicate with and work as part of an interdisciplinary team. They hold a lot of events that help facilitate interdisciplinary communication and collaboration. And so I feel really fortunate to have had these opportunities to start expanding my network and building these connections with providers that I hope to work with someday. This program has really helped me feel more comfortable and confident as a healthcare provider in communities that present really unique challenges compared to more populated areas that often provide greater access to a wide range of medical providers and specialists. And while this program has reduced some of the barriers to working in rural communities, such as that, I guess, fear as a new healthcare provider when working in a setting where I would have to be a little more independent, there still presents that financial barrier for me. I paid nearly $90,000 for my undergraduate program and am projecting to pay $97,000 for my graduate program. Both of these are in-state tuition, and I've had to pay for both primarily through taking out loans. And exclusion from this loan forgiveness program has really limited my ability to feel confident in working in a rural community because I feel the need to prioritize paying off my loans before taking a position in a rural community that may result in a slightly lower pay compared to an urban community. So I hope to encourage you all to advocate for PT's inclusion in this loan forgiveness program, as it would really provide new graduates, such as myself, to accept rural positions without concern about being able to pay off their loans. Thank you.
Hi, my name is Peyton Robinson. I'm a first-year Doctor of Physical Therapy student at OSU Cascades. I would just like to share some personal information about myself and kind of the connection to the rural community I have and advocacy for this program. Like many of the other students, I think our stories are very similar. So hopefully this is another perspective that you'll be able to hear. I was born and raised in Marcola, Oregon, a very rural community just outside of Eugene. Our town has a rough population of about 400 people. And one of my favorite facts is that in my graduating class, I only had 23 students, so very rural. But growing up in a small town, it's taught me many life lessons, but ultimately it's inspired my passion to give back to a rural community. I just recognize how much we need more accessible healthcare within my hometown, where physical therapy is really limited. I attended Pacific University for my undergraduate degree, and I've almost finished my first year of physical therapy school. By the time I graduate, my projected student loan debt will be approximately $144,891, and this does not include the accruing interest daily. Like many others, I knew the financial hardship that came with attending college and a doctorate program. To help pay for my education, I worked throughout the school year and I spent my summers working for a paving company. My education meant that I could pursue my goal of becoming a physical therapist. And like many aspiring PTs, I understood that pursuing this career would be a financial challenge, but however, I still took the risk because I wanted to make a difference. Regardless of my passion and work ethic, I will still begin my career with significant student loan debt. That financial burden will have a major influence on the decision I make throughout my career, and I understand I'm not unique in this situation. There are many students and other PTs in the profession who struggle with financial challenges, student loan debt, regardless of the amount of work and dedication they put into it. I believe those financial realities, though, often drive our profession away from areas that present financial challenges, such as rural communities in Oregon. Along with the significant student loan debt, many rural communities are experiencing rising housing costs and limited affordable housing. These barriers make it difficult for new graduates to choose to practice in communities that need it the most. And for many new grads, the decision isn't whether they want to serve rural communities, it's whether they can financially afford it. I truly believe that the loan repayment program would help bridge the gap. I believe the program has the ability to support our profession and expand access to physical therapy in rural communities, and ultimately allow us to do what we love most, which is to help people. The Oregon Healthcare Provider Incentive Loaner Program would help reduce those financial barriers. It would allow myself and others to pursue careers in rural communities, serving a unique and deserving population while still making financial responsible decisions. It would give our profession greater flexibility to choose a rural community based on where we're needed most, rather than where our financial situation lies. And choosing a rural practice should truly be a decision driven by passion and community need, not one limited by financial barriers. I had an awesome clinical experience in Primeville where I watched my CI provide essential care to an elderly woman with a fracture that may not have been recognized if she was not already receiving physical therapy. And I realized in that moment, my CI wasn't just treating her for deconditioning or pain. She was really helping identify a serious medical condition that otherwise may have gone unnoticed. Not only does this care be provided to a geriatric population, but also young children. I watched my CI perform a concussion evaluation on a young child the day of the injury occurred. Once again, in this situation, my CI wasn't just a physical therapist. She was able to be one of the first and most accessible healthcare providers. These experiences really reinforce how often we are the most accessible healthcare providers in rural communities. And I think many of us can agree physical therapy is a crucial part of rural healthcare. But our inclusion in this loan repayment program would increase awareness of opportunities to practice in rural Oregon. It would reduce the financial barriers for future graduates, and it would help address the growing shortage of healthcare providers so that rural communities can receive the care they deserve. Thank you so much for your time, Dr. Goldson.
All right, thanks. So, in conclusion, our ask is just that we ask that you include rural workforce solutions for physical therapists as a priority as you're going through the strategic planning process. We've presented, I think, some perspectives to help you consider the value of this and the impact that it would really have on the profession. And we just really thank you also for your time, your leadership, and your commitment to the PT profession and the patients we serve across Oregon. I know you're facing a lot of things with the new Practice Act coming up over the next year, and we just look forward to continuing to work with you to further our profession in this state and help the public. I and the students are now available for any questions or any additional discussion.
Okay, thank you. Does anyone have any questions?
I have just kind of a comment. I'm the delegate this year for our board, and so I just went to the federation meeting, which is the federation is for PT boards across the nation. And this was actually a little bit of a topic, especially in my small group, that how important that is for access. And yeah, there's a big push nationally for some debt repayment, especially for rural areas for physical therapies or underserved areas. So it's a national topic. I just want to let you know that.
Thank you. And we're hoping that possibly if we can maybe get state support that can help with some of the federal advocacy efforts as well, or vice versa, of course.
I don't see any other hands up or any other questions at this time.
All right. Well, thank you so much.
Thank you all. Okay. Next item.
Madam, pardon me, Madam Chair. Next, moving on to the consent agenda item, inclusive of the minutes for the May meeting, the ratification actions from since the last period. And I'm going to open this up. And then on the director's report, I would like to make a couple of highlights on the report. And I will make that bigger. I will try and make that bigger. Just want to call your attention to the fact that because this is the first meeting since the close of the first fiscal year of the biennium, that does mean that in the first section of the table, you have the results for that first year in the biennium. We did end up about 3.5%, give or take, over budgeted income amounts. And we are still continuing to hold under expenses. I do want to highlight that some of the underage in expenses is due to just the timing of when different projects or different charges from the end of the fiscal year, they haven't hit yet, even though they've been incurred. So that number in reality is not quite the differential that you're seeing there. The other thing to keep in mind, of course, is in this first fiscal year is the renewal cycle for the biennium. So the bulk of your revenue has already now at this point come in. And now you're going to start to see as we populate the second fiscal year data where you'll see month over month that expenses exceed the income. And that's predicted because of that cyclic nature of the 2-year renewal cycle. That also means jumping to the next page. When we look at licensing counts, this is at the end of the fiscal year, and you begin to see the slow growth back from the drop off from the non-renewed licenses. Typically that is between 14 and 18% that we've seen over the last several biennia. It was lower this renewal period, so we didn't see quite the dip that we've seen in the past. But that is what is accounting for that dip in total licenses. So moving to the lower part of the page here, oops, apologies. Where the first part is focused purely on Oregon issued licenses. When we talk about the total available individuals who are licensed or authorized to practice within the state, this is inclusive of the counts for both licenses and compact privileges to practice into Oregon. And we are still running at that 13% of PTAs and 10% for physical therapists are individuals who are holding a compact privilege. It's very important to keep in mind, particularly in light of the prior presentation, that these are simply numbers of individuals who hold the active license or compact privilege. This does not mean that all of these individuals are actively practicing in the state or providing clinical care. We did see this month a jump in applications. Of course, this is in part because last time you met, it was before many of the graduations. And so you are seeing that increase in exam applicants. Do want to note at the top, again, since we are halfway through the biennium with that total of 507 applications, these numbers down here are your sort of pace points, right? So we are running lower than we were in 21-23, but we should match or exceed last biennium's total count for applications received. So still suffering from that dip that in part probably came out of the pandemic, but we are on track for the budgeted number of applications that were expected. I think other highlights, there are the compact privilege numbers that are in these reports. They're very similar in the totals that you saw in the last meeting's report. I will jump to, of course, the investigation and the counts for total open cases and remaining. We'll bring to you some more information in an upcoming meeting about overall trends. But one of the things that we continue to see is an increase in the number of cases coming in, number of complaints coming in. That trend line continues to grow. And if we then look down to our halfway through the biennium on these numbers as well, these are the overall trend lines on opened and closed. And here you get a sense of that in the current biennium 25-27, 64 cases that have been opened relative to the total 2-year of 96. So you can start to see the increase in those numbers. And then under administrative highlights on the next page, you see the education and outreach and participation there from staff. I do want to note that we are happy to have hired our project implementation coordinator for the House Bill 3824 for that implementation project. And we did successfully set up a partnership with the Board of Speech Language Pathology and Audiology for the provision of investigative support. Those are both topics that you talked about in your last meeting, authorizing some additional support, and that process has started on both counts. We'll talk a little bit more about the House Bill implementation project in an upcoming section. The final highlight from the director's report is the dashboard of the statewide agency expectations. We did submit the yellows that you saw last time with regard to the DEI plan, strategic plan, IT strategic planning updates that were required by June 1. Those were submitted before the deadline. And the yellow, of course, is my conservative indication that that is the next upcoming deadline that we have. Emergency COOP plan, which stands for continuity of operations on that. And there is also the, it's not yellow yet, but the next one after that would be the succession plan, which is due by the end of the calendar year. With that, I will pause. Madam Chair, entertain any questions or comments that folks have on any of the materials from the consent agenda.
Okay, thank you, Michelle. Anyone have any questions? Going through my review on the side, I don't see any hands up at this time. Okay.
In that case, Madam Chair, we would just need a motion for approval of the consent agenda.
I guess we didn't have our Erica. Could you be our motion person?
Sure.
And then Erica, for the record, if you just restate or make the motion to approve the consent agenda as written.
I make a motion to instate the consent agenda as written.
Second.
I second the motion.
We've got a couple of seconds.
Yeah, I think
Oh,
I think Tim beat you to it.
okay.
Madam Chair, the motion's been first and seconded. Roll call vote. Timothy,
Aye.
Aaron is excused. Mariah,
Aye.
Sandra,
Aye.
Puku is excused. Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay. Thank you. Next item, there we do have one member of the public present. Is that correct?
Yes, ma'am. For guests attending, if you wish to make a comment at this time, you could raise hand or come off mute. I can give you a moment.
I am totally good. I'm just here for the 3824 conversation that you all are going to have. So thanks so much, though.
Okay.
Okay. Next item.
Next item are the delegate reports. For the, I can go ahead and give a brief update with the absences on the Compact Commission. Oregon, we continue to meet the compliance thresholds required for participation in the compact. And the PT Compact Commission has made improvements to its website, including a tool for verifying eligibility for compact privileges. They've also added some improvements to 24/7 help desk chatbot technology to answer questions that folks may have even when staff aren't available. And on the Federation side, there have been a couple of committees and task forces that have met since your last time. I believe the first one at that time was Sherry Peru is a member of the Federation's Code of Ethics task force that was established. Sherry, do you want to say a few things on that?
Sure. The task force met one time at the beginning of May, and it was a really interesting meeting because we had representatives from the FSBPT and also from the APTA. And what we did was we're looking at doing a model code of ethics for the Federation. So not just using the APTA code of ethics, but also having our own, because there's quite a lot of states that actually are not allowed to refer to another group's code of ethics. So we had a really, really busy 2 days. And then that was also then presented to the board and at the life meeting. And I unfortunately missed that part of the life meeting to hear the presentation, but maybe Michelle or Sandra, who was there, can speak to the reception to that when it was presented.
Absolutely. The reception was very positive. And it is something that all of the membership across the U.S. Has been seeking this kind of model code of ethics, in part because, as Sherry mentioned, there is the barrier in some jurisdictions to being able to make that third-party reference, if you will. So the rules have to be internal to the state's statutes and rules. But also APTA in their latest version of it made a number of improvements, including combining both the PT and PTA documents that impacted some jurisdictions that in their statutes referenced those separate specific items. And then there's also the addition of aspirational goals in APTA's Code of Ethics. The difficulty there is from a regulatory standpoint, those aren't enforceable in the same way as other standards. And because of that, the task force had put together a number of recommendations and standards that were presented, and the feedback was all positive in the groups that I participated in. The other committee that met recently was the Continuing Competence Committee in mid-June, I believe, which did a review and update on the Healthy Practice resource, verification of the materials and addition of newer materials to support that tool, and some discussion on the next versions of improvements on that, as well as looking at developing content that jurisdictions could use for doing presentations out with licensees or with students in the academic programs to get the word out and provide more information about that material. And then just a couple weeks ago was the Leadership Issues Forum. There were about 123 attendees from across the U.S., both in person and virtually. And I'd like to turn it over to your delegate, Sandra, to share some experiences from that event.
Well, I did it virtually, which that was interesting in itself. Kind of some highlights that just were my impressions, where there was a lot of discussion about AI and how it's really just kind of running away already, and how that's being used and how regulators are going to get a handle on that to even know kind of what's happening now, and then what's the role and with regulation with that. Another one that I really was interested in was movement towards trauma-informed care being part of regulation, being that. The healthy practice tool, Michelle just talked about that a little bit, and I have to, can people use that now as a CE and R in Oregon?
Yes, up to the
Yes, I know we've been talking about it a lot. I just wasn't sure whether we had done that, but a lot of states are still really trying to figure out if they can use it and how they can use it. And there's barriers for some states to being able to use that. So that was interesting because I'm just, every time I see this tool, I'm pretty impressed with it, that the potential of it for being proactive. Those were kind of my highlights. I feel like I almost had more questions than I have things to report on after I went. It was one thing that kind of kept coming up. So I was in a pretty small group. So there's all these other people are at tables, and then they move to different tables. And so there's groups, but I was pretty much with the same people for both days. And there was a woman from Alaska. There was somebody from Alaska, somebody from Hawaii, somebody from Washington, D.C., and somebody from Missouri that were that sticks to my mind. And one thing that kept coming up in the group is that people felt like that their practices were so unique that, especially with the compact, they were feeling like that, how do we get people that practice competently in our situation? And first I was kind of thinking we're more similar than we are different. But then when they were talking about the particulars, that even the practice could vary, they felt like in Alaska, they felt like that sometimes they had kind of had expanded rules that just needed to come with the practice environment. And then in the Washington, D.C. person really felt like that you really need to be able to be diverse and be accepting of diversity, that there was a lot of that. So I don't know, it was just something that to me was really kind of really interesting thinking about that, because I hadn't really thought about that as much when they were describing their differences. I don't know how I felt about I don't have a conclusion. I just thought it was interesting to bring back to you to think about. And then there was some discussion, and again, it's more questions than it is answers, but that good moral what's it called? The good moral character that so many people have in their qualifications to practice, and yet how do you apply that? What good is that really to have that in there? We want that, and what does that even mean nowadays with so much changing so quickly in our society? So that's kind of my highlights. I did have a question for discussion, and that is, I don't recall ever doing this, but what guidelines do we get to bring back to the board for voting for when we're choosing candidates? I don't remember ever talking about that.
That's a great question. That is part of the just the reminder on the elections. The delegate has the obligation to cast the vote for Oregon for the positions, the candidates for the Federation Board of Directors and Nominating Committee. In the news briefs, there are the candidate statements have been made available, and there was a candidate forum that was recorded that should be available in the near future. So there isn't a specific process that a board has to go through for Sandra, but I would encourage folks to review the candidate statements, and if you have any questions or feedback for Sandra, to have those conversations with her ahead of the October meeting. Um, uh, and it's also helpful if you have a particular question for one of the candidates that you'd like Sandra to submit, so that question gets asked to inform the process in the delegate assembly.
The good news is they're all good. The nominating committee has, they're all good. So, I mean, I was like, oh, how do I choose? So be sure and take a look at those if you have a minute, but do rest assured that there's really no wrong answer. And our favorite one is running unopposed. So that would be Michelle.
Thank you, Sandra. Thank you. There will be a summary report from all of the discussions and the topics from the LIFE meeting that will be available in the next month or so. So I would expect that that's something that can be available and included for the board packet for your next meeting. I think to some of Sandra's questions, it's a great source for when we get to the section on future discussion topics that you want to see or presentations that you want brought back, to review that and then have that discussion on what you want to place on a future agenda.
The other thing I do have to say, doing it virtually, it started at 5 a.m. So especially the first day, I really felt like I was just fighting for consciousness to kind of stay engaged. And it's more challenging to do that virtually too, of course. And so I kept telling myself, well, it could be worse. I could have traveled all day yesterday because it is the same time, but it did feel really different. And it was really smoky at my house, so we're stuck inside it, but it was also really smoky in Washington, D.C. over that weekend. They were all, I think the woman from Washington, D.C., I'm not sure, she was there with us the first day virtually, and I think the second day she was able to attend in person, and I think she attended virtually because her childcare got canceled on Saturday, was my impression. I mean, from things she said, but Yeah, it was really interesting. That part was really odd too, but anyway, doing my best.
Thank you, Sandra. Any questions or comments on delegate reports? Next agenda item is just that touch point that you have every meeting for the strategic planning and the progress review. Again, very specific focus for 2026. Renewals obviously worked through the body of that, the rulemaking that we'll be talking about in a minute. The licensing system stability replacement. I've mentioned before that although the board is a semi-independent agency and has options for contracting with vendors, that we've been participating in the development of a statewide RFP process for master agreements for licensing systems. That's a process that has been going on for potentially 6-9 months, quite a long time. That document has now been published by the Department of Administrative Services Procurement Department and is currently open for submissions. That will be open until approximately mid-August, and then the review process will begin, which typically takes another couple of months before they can establish the vendors that will be part of that master agreement. So we are monitoring that process. We're monitoring the health of the vendor and the systems that we're using. We would prefer not to have to make any sort of major systems change while we're also implementing 3824, but we're keeping those different pathways open, and we'll keep you apprised when we get there. And we are going to talk a little bit more about some of the other items. Any questions on the focus here? Okay. This is your list of future topics that we're tracking toward for future agenda items or the addition of new items. Sandra did touch on AI and regulation, and there have been some resources, both written and webinar resources that speak directly to this topic that I think would be helpful for the board. So what we would plan to do is bring and include in your packet prep materials, and then in the public materials for the next meeting, links to those resources and materials so that you can review those and have discussion at one of the next meetings on that topic. Pardon me. And then on the first bullet, we'll talk a little bit about the continuing competency offering pilot that you discussed at your initially at your March meeting that we have some updates on. But is there anything else that anyone wants to add to this list at this time? Okay. Okay to proceed? Okay.
Yes.
All right. Now we're going to talk about the main event, the implementation project for House Bill 3824. And I'm pleased that the implementation coordinator that I mentioned earlier, Jade, is also with us this morning and available for comment. But what we want to do is bring to the board the more refined work plan that was discussed with you in prior meetings. The first item a little is just for perspective, what we've showed you before is that shorthand for this is that significant changes to the statutes, and when the statute changes, your rules have to change. For us, this means 97% of the rules that the board oversees have to be changed in some ways. Some of those, of course, are minimal, changing references or resorting or a new definition. Some of those are pretty significant, where there's a new statutory authority or statutes have been repealed and language has to be routed to a new section. So a significant body of work that's represented over approximately the next year. I'm going to move around on this slide to kind of zoom in because there is a lot here, but this is the draft work plan from essentially now. We are at the very end of July in the upper left-hand corner, going through the goal line, if you will, the effective date for everything, which is July 1st, 2027. So you have the next 6 or the current 6 months and then the final 6 months on that. And there is a legend on that. If the graphic elements are gray, that is preparation or coordination or partnership with other agencies in order to do the body of work. Where you see green, and I will drill into these, but green represents work group recommendation development, establishing work groups, meeting with the work groups for them to make the recommendations to you. Red diamonds represent your board meetings, which are touch points for bringing information to you. The blue is the formal public rulemaking process, where draft rules are published, and then you have your full comment, public comment period. And then the purple color is the back end, everything that needs to happen internally as far as communication, outreach, and operational implementation, as everything from updating policy documents, making system changes to account for anything that may be new. All of that is what we're trying to represent and how it's all connected. I'm going to attempt to zoom in, and I'm a little hampered here because I think I closed the tool view. So you're going to watch me. There we go. If I jump in here, I guess first, let me scroll over a bit. In doing the work, what we've determined is that it would make sense to have 2 different work groups on this. A primary work group or main group that would be assembled to handle most of the sections of the bill, which is what we're talking about, where you see represented I don't want to zoom in that far. Where you see the main work group being assembled in August and September. That's focused on the sections of the bill 2 through 4, 6, 15, 17, 18. The reason those are broken out from the others is that this second gray bar here is partnering with other agencies for 16, 19, 20, and 21. Those are sections where the change is in not your prevailing statute, but another agency's or board's. Because it's their statute, their primary on whatever the process related to rulemaking will be, and anything that you may do with regard to rules that you would want in your sections needs to be done in coordination with them. So that is an unknown about whether that would generate work groups or even rules for you, which is why there's the sort of the hash line that extends out. But in August and September, we would be working with them to determine what the scope of that is and whether there would be interested parties from the board and from the licensing base that would participate on their processes, or if you would generate one. But otherwise, everything else would be part of the main work group, except for, and that's where you see down in October and through December, the formation of the Section 5 work group, which is a separate group that would focus on the dry needling aspects of Section 5. Part of why that's broken out in part is because of the governor's explicit direction to prioritize every other section of the bill with regard to rulemaking activities before doing Section 5. So you can see what that means is that the work, even though we would be coordinate. Oh, and the second piece is that you are directed to work in coordination with the Oregon Medical Board. So that process would begin in September and October for forming the work groups for Section 5. We felt it was important to begin that work with the community and with all the interested parties to know what was happening when, and establish those work groups as early as possible so it could get calendared for the work that's actually going to be done by the work group in February and March of next year. Okay. The other explanation to give here, when the work group develops their recommendations to present to you for consideration, the main work group is expected to meet between October and January. What we've determined is that there may be some early work that could come to you at your November board meeting, which is what you're seeing for this optional line starting in December. The work group would continue to be meeting in December and January on the remaining body of work that would be initiated for your January meeting, right? But it's optional because if there isn't enough ready for that November timeframe, then all of their body of work would come to you for that January meeting. The other sort of important point is you'll notice in March that there is a blue and with a red outline stop point for a bulletin submission. The reason that that's highlighted in March is because of the way the formal public administrative rulemaking process works. There's a certain amount of time that's required for publishing it in the Secretary of State's office bulletin, scheduling a public hearing, notification to legislators, and that's really the last meeting for all of that to happen before the July 1 effective date. What happens here between that date for noticing that is that final public rulemaking for Section 5, the results of the public input on the draft rules that you've submitted for public comment at the end of March would go to the proposed May meeting for that submittal. We can't really push it out and hit that effective date. So I know there's a lot on this chart. It's a big effort, but I'll pause there and ask if there are any questions on the work plan. If not, I'll move on to the main work group charter, and then I will throw this slide up again just for fun so you can see a little more context. So in that main work group charter, the purpose and the scope, of course, is these sections, and it is Again, everything other than Section 5 dry needling or the few other sections such as imaging or the placard language that and animal rehab that are in other folks' statutes. But they will be making those recommendations to you on draft rules or guidelines or procedures that it would take to implement those sections of the bill. What we're proposing for membership for the work group would be 4 to 6 licensed individuals that are currently clinically practicing in Oregon in a variety of care settings. The examples here aren't intended to be limiting, but we're wanting to get as broad a representation of clinical practice in different care settings as possible. And seeking someone with the minimum of 3 to 5 years of clinical practice in Oregon. Also, at least one individual who currently holds or has previously held an Oregon compact privilege, or who is someone who's actively licensed in multiple states. Part of that perspective is, and Sandra touched on this before, is that there are practice differences in different jurisdictions, different states, even just right across the border. And that perspective and how it impacts mobility or knowledge of how something may be performed in a different state could be of value. Given that this is everything that there is, including everything that has to do with licensing, the one individual who's a graduate of a non-CAPD accredited program and one to two individuals and one individual who's a recent graduate of a CAPD program, sometime within the, so a new grad of a CAPD accredited program, and then one who's a graduate however long ago of a non-CAPD accredited program. Hoping for 1 to 2 individuals who represent the APTA Oregon, in part since this was a bill that was introduced on their behalf. And 2 individuals representing educational programs in the state, a member of the general public in the same way that we have a public member, 2 public members on the board. And then a member from the sponsoring legislator's office has an ex officio member to participate in this process. Any questions or feedback on this draft of the work group membership?
How do people get involved? What's the way to sign up for this?
What we're intending to do, if the direction that we're taking for the work plan, and here's that slide I'll throw at you again. If you're comfortable with the work plan, the direction, and the scope of the charter and the membership of the work group is in August and September, that we would begin soliciting participation in the work group. We're envisioning that we would send out a news brief indicating that here's the work plan, here's the charter, here are the positions that we're looking for. We're also intending to include in that the schedule of the meeting dates that we would establish within the year, so that folks who are signing up know what the commitment is and are able to commit to those meetings ahead of time. They would apply for participation on the work group. And then what we would do is look for being able to fill those different seats, right? And make sure that we can have as broad a representation. And what you didn't see in that membership was any explicit mention to regionality, but in part, we would want to filter or sort the applications to have the broadest geographic representation as well as specialization or other things. We want to make this as broad a work group as we can. So we would send out the email to the interested parties that we have list, as well as all licensees and other individuals. They would submit an application through a survey form. All of this process would also be posted on the website. And then what you have in early September, then from that, we would establish the work group so that it's formed before the work of the work group would start in October. Okay. So I'll loop back here, but otherwise, any other questions or concerns about the work plan, the timing, the approach? Seeing none, I think we have our marching orders. Then later today and Monday, we would be, we'll distribute this information that it's coming. And then in the next couple of weeks is when we would be sending out the request for work group participation. Okay. Madam Chair, should I proceed to the next item?
Yes, please.
Okay, update on renewal audits. We spoke to you before about the CC, or the continuing competence audits, where that is a mostly random 20% selection of individuals. We were initially planning to complete this even before renewals had finished in March and April. But with other workloads, that's been delayed. We are about 35% complete with it, and then that work will continue as we go along. The disclosure auditor, what I've previously described as the LEDS audit, which is just the name of the system, is 100% done. And any results of that, or any information that may need to go to the board would come to you in a future meeting. But great appreciation goes out to Sarah for all her work on both of those audits. Next item isn't a heads up, really, that even though you, the board, did not introduce any legislative concepts for consideration for the 2027 legislative session, the federal government did notify Oregon that the current statutes related to authorization for fingerprint-based national criminal records checks no longer meet the federal requirements. They did luckily simultaneously grant an extension for the non-qualifying statutes to 2030, but only for existing statutes. One of the unique situations that we are in is that your statute 688.061 is one of the statutes where there were changes as a result of 3824 that isn't effective until July 1, 2027, which means it's a new statute going into effect after this notice and would not be considered potentially an existing statute. So there is some urgency for making some adjustments. Oregon State Police is leading an effort to make across the board of changes because every entity that does fingerprint-based background checks for licensing, for employment, or for other purposes needs to have adjustments made to their statutes. So we are working with them to make updates, particularly R 688 and in 676-303. That is a common statute that all of the health professional regulatory boards use and reference. So we're also working with all of the other health boards to look at how all of those processes align. And the objective is to create statutory language that maps to your current historical processes and how your authority works now. Um, it does also mean that we will need to participate in the legislative process as that legislative concept gets introduced. So just a heads up at this point, but more to come on that.
Okay. Any no comments? So next item.
Okay. On the next item, in part because we had to map out the next year's work, which is dependent in large part on when board meetings happen so that everything works out. Based on the algorithm that you've used the last several years with regard to targeting the third week of the odd month through the year, and then attempting to avoid holidays or other events that would impact your work. This is the proposed schedule for 2027. It is the same general pattern that you've been using where most of the meetings are virtual, like this one, with a executive session in the evening of Wednesday, and then the public and potential executive sessions on the Friday mornings. There would be proposed here 2 all-day in-person meetings, which are both combined in May and in September. And what I have right now is just a placeholder for a short public session, which could be Zoom or phone call, the week of June 21st. We aren't approximately June 21st. We aren't offering a specific date now, but in addition to all the other work that's happening, we will be coming to the end of the current biennium, which means all of the budgeting and other review work that you need to do for the next biennium needs to be done and in place before July 1, 2027. If we can't get everything to you that you would need to consider before that deadline in May, then we would reach out to you and check your availability to schedule something toward those last 2 weeks of June. Are there any concerns or issues with the current proposed meeting calendar? Okay, if not, Madam Chair, for this one, you would need to entertain a motion to approve the proposed 2027 board meeting calendar as written.
Okay. I don't see any discussions or any hands up. Yes, Dwight, I see your hand up.
Is it November 11th, Veterans Day?
The 11th is, yes.
Okay.
So the 17th and the 19th, right, as the meetings for November?
Yeah.
Can you scroll up? I can't see it. Okay.
Oh, sure. If I can scroll without switching the slide. That's another question. Is that visible to you now?
No. Oh, now it is.
Okay.
Oh, okay. 11 is the month. I'm sorry.
Yeah.
Never mind. As you were.
Any other questions?
Like me to do a motion?
Yes, that would be
Okay.
great.
I would like to make a motion to accept the board meeting calendar as proposed.
Thank you. Virgo. Anyone like to second that motion?
Second.
Mhm.
Motion is first and seconded. Roll call vote, Timothy.
Aye.
Aaron is excused. Mariah.
Aye.
Sandra.
Aye.
Hoku is excused. Susan.
Aye.
Erica.
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay, thank you.
Next item, we wanted to bring you an update on another one of your strategic activities, and that is the Healthy Practice Resource Pilot. Just as a reminder, the scope of the pilot is the use of the Healthy Practice tool as part of the complaint investigative process. On this, you've seen this before. In the last two boxes, we added some clarifying language based on the last discussion that wasn't clearly called out in the bullets, but it's related to the post survey is an anonymous post survey about the pilot process itself, unless there were a specific settlement agreement, there were a different term that would change the frame of that. And then just noting that the materials are confidential other than anonymized aggregate or anonymous comments about the process itself. So with that context, we have moved into the active pilot section. And that will continue until the formal review point of July 2027, because everything is going to happen in July 2027. But we, since we are in rollout, we wanted to share with you some of the preliminary feedback on the process on that. So this is one of the questions that is asked on that post-process anonymous survey. The survey presents the statement that you see at the top of the slide, and then it asks, based on your experience in that statement above, how would you personally rate the following: the modules of the practice tool itself, the assessment template provided, and then their overall experience. And what you can see is that everybody who's participated and completed a survey so far has it in the moderate high to high value. And then another question asks, even if you did not find the tool or the process of value personally, do you believe there's value in offering it as part of the complaint investigation process for others? Of the preliminary feedback we've gotten so far, it's been 100% yes. They see the value. And then this is just a call out. There's a little bit of paraphrasing here. And although I missed one, some punctuation additions here, but you can see that some really positive comments from folks that have been participating so far. Small sample size, of course, because we're just getting started, but we just wanted to be able to bring you that preliminary assessment that that the pilot that you implemented is moving forward, and it seems to be accomplishing some of the goals that you set out for it. Any questions on this one? Okay, we have another pilot for you. And I think initially Well, it's been one of your strategic objectives under prevention and education and outreach. You previously talked about creating this pilot about board sponsored or board created continuing competence offerings. Topics relevant to law, trends that we're seeing, licensing. You wanted it to be free or very low cost. You had seen part of what the state of Louisiana has done where they do an all-day conference, but your focus is on individual courses at this time, that they would be for credit under the continuing competency requirements, and that it would be focused on content that's delivered by board staff, potentially other speakers if we could arrange them. But given that many staff participate or present on topics elsewhere and nationally, that there was some opportunity to repurpose and expand the value of those presentations for all licensees, and that we would target virtual or in person as long as that in person had some other adjacency for work that we had in a given area. So we had an opportunity to do that. And just this past week, Sherry Peru was in Bend, Oregon, and offered this 90-minute, ended up being a little bit longer, I think, on that course on the trauma-informed approach for complaint prevention. It was planned because Sherry was out presenting to the OSU Cascades PT classes, which also created the opportunity that OSU Cascades did offer up the venue so that the meeting could be held there. And then what we did is we targeted outreach to licensees that were in Deschutes and surrounding counties in sort of a radius around Bend, folks that we thought could reasonably get to this this pilot offering that we tested out. We then asked them to, fill out the post course survey, and of the attendees, all of them submitted that and gave it a pretty good rating. Seemed to be fairly successful on this side, but I do want to turn it over to Sherry to talk about how it went and address any questions you might have about both the pilot and kind of consideration of next steps of doing it elsewhere and how that might work.
Thanks, Michelle. So I think it went really well. I mean, it was a Monday evening in the middle of the summer. So I was, when you have a birthday party and you're a little kid and you think no one's going to show up, that's kind of how I felt. I waited for a few minutes. People had registered, but because it was free, sometimes there's that nervousness of it's free, maybe people won't show up. But we had 14, maybe 15 people. I think someone left a few minutes early. I still have to check to see if they're included in the survey or not. And what I was actually really impressed about is I thought maybe it would be all attendees that work at OSU Cascade, since they all knew I was coming and they all helped me organize. And actually, we only had one employee faculty from OSU Cascades, and everyone else worked in lots of different kinds of care settings. We had someone from a school, ESD, we had home health, outpatient, hospital. So it was a small group, but I felt like people were pretty engaged. We actually wound up staying about 15 minutes over, lots of questions when it was ending, and we got to chat, maybe a little more informal at the end. And it seemed like, pretty positive feedback. Even before I saw the survey that went out. We talked a little bit about the bill as well and the work groups, and kind of gave them some preview of what's coming. And yeah, I thought it went pretty well for the first time.
One of the other questions that we did ask them is, do they think the board should continue to offer this kind of offering, and are there other topics, and very positive comments on those as well for both. interest in attending other events. And then we did solicit a little bit on the kind of topics that they might be interested in. So I feel that the this initial sort of test, since we had the opportunity to do kind of a small scale test, seemed to go well. So I wanted to check in with the board, report this out, and see if this is something you would like us to continue to pursue.
If we keep doing that, this is very cool. Also, is there any way for like other board members to get involved? Like, I don't know, like I would love to come and like help with one of these, just be like a standby assistant.
Absolutely. We were, as this rolls out, particularly for the in-person region areas, it would be great if board members who are in the area could also participate or at least attend and be available to meet with folks, right? That'd be great.
I had meant to volunteer to do that. Wouldn't have worked out anyway, but I would love to do that too, even when I'm not on the board. If there's space, I would love to do that because this is it's proactive and preventative. I just love it. So thank you, Sherry.
You're welcome. Yeah, it was nice to have a group. It would, after being at the board for 24 years, I felt like I knew everyone, and I had a group of 15 people that I don't think I knew anyone in the room other than the one person from OSU. So I mean, I knew some names, which was kind of nice too. Like I was like, oh yeah, hi. But it wasn't, people familiar to me. So I think that was nice to see as well that we reached out and they found the topic interesting. It's hard to get people to want to listen to a topic on boundaries just in general, versus something clinical. But I think it was well received.
I still think it seems like, I'm ending my service here pretty quick, but I still think that it's technical physical therapy's pretty low risk for people to cause public harm, but all the boundaries and that kind of thing is where our greatest risk is, I think. So that's my viewpoint as a public member. People don't make technical errors very often, but the other stuff is out there and it's not usually the top of people's awareness about that.
Yeah, we talked about that.
I have a question, Jerry. This is great, and I think the support to continue it. But in terms of your workload and like how much time you put into developing this and then carrying that out, and how that impacts, yeah, just your workload in general. And
Yeah, that's a good question. I think part of it is we planned it when I was already going to be down there speaking with the students. So it made for a long day. I met with the first year students and I had at 8 o'clock in the morning, at 2 o'clock in the afternoon, and then this was in the evening, all in the same day. And I think I started this particular topic because I've already given this presentation before many times. It's very similar to the one I gave in Louisiana and the webinar that I did for the FSBBT. So workload wise, I didn't have to do a ton of prep work for this presentation other than the adding in some slides about the new House bill. So yeah, if I was going to have to create new topics and new slides and things like that, then that might be a little more work. But I also have several presentations that I've already done. And we talked about the healthy practice tool as well. I gave them some information on that, and I already had, that information in a slideshow. So it wasn't like that much extra work for me because I was already there. But if I was going to specifically travel somewhere to do that, that might be a different thing.
And there isn't the capacity to do a full program in that sense, that's um, separate and dedicated in development of new content. The only way that this works currently is by using that incremental effort and repurposing content from elsewhere. Then we can kind of get maximal benefit for incremental work, right?
And this is where the Federation has a lot of things that they're developing too. So it doesn't have to be like a live new presentation. I think those Federation tools that people like Sherry have already worked on and
I
have
showed
up
the
there.
videos. I showed the
Yeah.
sexual misconduct videos. I talked about the resources that the Federation has. We talked about the healthy practice tool. So I kind of gave them, a lot of information that I think we don't realize that licensees have no clue about.
Yeah.
And I got the sense from the people in attendance, they thought it was really nice that we were doing something proactive and free for licensees. Versus just coming across as being, punitive and investigating people.
Right. Right. I'm still amazed really how so many practitioners really don't have that much awareness of their licensing boards and think of them as pretty punitive and bureaucracies, and that's another thing that came up at the meeting too was, there's still that drive for to get rid of government regulations basically and regulatory boards. So that was another thing that I didn't mention that earlier, but that seems like that's a topic every year, and it only gets kind of more intense every year with the national trends we're in.
Yeah. Okay, so what I'm generally hearing is proceed that when there are the opportunities that we can use existing content and find an adjacency, that we should continue to take these opportunities. All right. And I could probably use this opportunity to call out, Sherry referenced it, but just a few weeks ago, or maybe last week, I get Sherry's official 24th board anniversary, as we like to call it. So a shout out to Sherry for her decades and continuing service. Thank you.
That's crazy. Thank you. It definitely does not feel that long.
Not a day over 18, right? Okay. Next item, it's that time of year, so one of the procedures that you go through on an annual basis is the board best practice review. There are the criteria here. Each individual board member should make a individual assessment on your performance on these items. These are reported out as part of the biannual governor's report and to the legislature on what your rankings are on this. And we typically have a discussion on anything on anything that you might raise or have questions about, in part to make sure that you're tracking to your obligations as the board for these best practices, or if there's something you have a question about or that we could do better as staff to make sure you have the information that you need on these topics. With that, we can is there anyone that has a question about or any of these items, or that wants to discuss it further, or feels that there should be a no on any of these items?
I don't, I mean, are people reading these now? Have they, or no? I don't see any hands up or any questions this
Seen a
time.
couple thumbs up, a couple nods, yeah. Not seen any questions or any no's, Madam Chair.
Okay.
Okay.
Now,
Then,
moving on.
just for the record, we will note this as all of the members present today noting yeses on these items and that there weren't any concerns or questions raised. Okay.
Okay. Okay.
The next item that you have on an annual delegated authority review, the documents, this is a version of it. It highlights the last time that you reviewed this was in September of 2025. And what you did at that time was add the clarifying language that's highlighted here in red. We aren't bringing to you any recommendations for you to consider changes at this time. So this is only to make sure that you have had an opportunity to review the document or make any changes that you feel would be appropriate. And this also was included with the consent agenda materials. Maybe one thing I'm going to highlight or jump to the next page because it is relevant for the work that is coming up. This is your delegated authority for permanent or temporary rulemaking process. So as a general rule, everything would come to you before initiating rulemaking, other than certain situations where staff are authorized to at least begin to the process. The board or the staff never has the delegated authority to put in place items, but can do things to start the process to then bring to you. So, did anybody have any questions or concerns with the current delegated authority? And I'll jump back up.
No questions or concerns from me.
Okay. Okay.
All right.
Then if that's the case, Madam Chair, you would just need a motion to approve the delegated authority letter as written.
Okay. Erica, would you be are willing to put forth that motion?
Yes, I would like to make a motion to adopt the delegation of authority letter as written.
Second.
Motion is first and seconded. Roll call vote. Timothy?
Aye.
Aaron is excused. Mariah?
Aye.
Sandra?
Aye.
Hoku is excused. Susan?
Aye.
Erica?
Aye.
Dwight?
Aye.
Madam Chair, the motion carries unanimously.
Okay, thank you.
And with that, Madam Chair, we have completed the portion of the public agenda prior to the executive session.
Okay. So at this time, I think we will convene into executive session.
Yep.
Okay.
You can go ahead and read us in here for the record for these
Yeah.
items and then the time. And then at that point, anybody left will move into the waiting room.
Gotcha. Okay. So the time is 10:16 a.m. and the Oregon Board of Physical Therapy will now convene into executive session as authorized by ORS 192.660 little 2 or 2 little f and or big L. In executive session, the board may consider information obtained as part of an investigation into the conduct of licensees or applicants, consider investigatory information and reports under ORS 676.165, or consider other information or records exempt from public inspection, including advice from the board's legal counsel. Representatives of the news media and designated staff shall be allowed to attend executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on or otherwise disclose any of the deliberations or anything said about these subjects during the executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session.
Thank you, Matt.
The time is 12:15 p.m. and the Oregon Board of Physical Therapy is entering into public session.
The next item on the agenda, Madam Chair, would be any board motions as a result of executive session.
Okay.
Okay, and Madam Chair, in case number PT 902-04/25, I move to close case.
I second the motion.
Madam Chair, the motion's been first and seconded. Roll call vote. Timothy.
Aye.
Member Aaron is excused. Mariah.
Aye.
Sandra.
Aye.
Member Haku is excused. Susan.
Aye.
Erica.
Aye.
Dwight.
Aye. Sorry.
Thank you, sir. Madam Chair, the motion carries unanimously.
Okay, thank you. Next case, please.
In case number PT 970-07/26, I move to close case and issue license.
I second the motion.
Motion has been first and seconded. Roll call vote. Timothy.
Aye.
Member Aaron is excused. Mariah.
Aye.
Sandra.
Aye.
Member Haku is excused. Susan.
Aye.
Erica.
Aye.
Dwight.
Aye.
Madam Chair, motion carries unanimously.
Thank you. Next case, please.
For the next case, I need help with the case number.
Case numbers should be PT 924-1025 and PT 931-1125.
Michelle, can you say those one more time? I apologize, unless I don't have to repeat it again, but
Probably best to
Yeah.
have you do it in the motion. So the first one is PT 924-10/25. Second case number is PT 931-11/25.
thank you. Okay, Madam Chair, in PT case 924-10/25 and PT case 931-11/25, I move to find violation of ORS 688.140 to little a, little I, little m, and OAR 848-045-00 or 0020 to little h, little I, little j, little p, and offer a settlement agreement consisting of 1 year license suspension effective November 21st, 2025, immediately followed by a 2 year probation period with conditions and a $500 civil penalty stayed pending successful completion of probation.
I second the motion.
The motion has been first and seconded. Roll call vote. Timothy?
Aye.
Member Aaron is excused. Mariah?
Aye.
Sandra?
Aye.
Member Hoku is excused. Susan?
Aye.
Erica?
Aye.
Dwight?
Aye.
Madam Chair, the motion carries unanimously.
Thank you. Next case, please.
In case number PT 836-12/23, I move to offer settlement agreement with 2 years probation and conditions as recommended in evaluation and mandatory random alcohol testing.
I second the motion.
And Chair, the motion has been first and seconded. Roll call vote. Timothy?
Aye.
Member Aaron is excused. Mariah?
Aye.
Sandra?
Aye.
Member Hoku is excused. Susan?
Aye.
Erica?
Aye.
Dwight?
Aye.
Madam Chair, the motion carries unanimously.
Thank you. Next case.
Okay. Madam Chair, I move to ratify the administrative closure of case PT 971-07/26 and PT 972-07/26.
I second the motion.
Motion's been first seconded. Roll call vote. Timothy?
Aye.
Member Aaron is excused. Mariah?
Aye.
Sandra?
Aye.
Member Hoku is excused. Susan?
Aye.
Erica?
Aye.
Dwight?
Aye.
Madam Chair, the motion carries unanimously.
Thank you. Are there any more cases?
There are no other cases.
Okay.
Madam Chair, there is no other business for the agenda today.
Okay. Then the time is 12:22 and the Oregon Board of Physical Therapy is now adjourned. We'll see you in September.
Thank you.